We are so pleased to have Ambassador Bonnie Jenkins with us here today. Ambassador Jenkins is the founder and executive director of Women of Color Advancing Peace, Security, and Conflict Transformation. She's also non-resident senior fellow at the Brookings Institution, chairperson of the Committee on Radioactive Sources at the National Academy of Sciences, and she was former special envoy and coordinator for threat reduction programs at the United States State Department. Welcome, Ambassador Jenkins. So you're joining us today via this webcast because we are all sort of in lockdown, in quarantine. As of this morning, the world has passed over 2 million people with confirmed COVID-19 cases in over 177 countries around the world. And of course, we know that global health is on everybody's mind today. And we also know that there's a lot of controversy going on with the WHO this morning. So I'm hoping maybe you can start off by talking a little bit about this initiative that you've been involved in since I think around 2013 called the Global Health Security Agenda. Can you just sort of give us some background on that?
Yes, of course. And thanks for inviting me to do this. And I hope everyone stays safe and healthy out there. Just very briefly, the GHSA, or Global Health Security Agenda, was really launched in 2014, but it started with some work within the U.S. interagency process of a number of organizations and departments within the U.S. who all play a role in the infectious disease, whether that's for the prevent, detect, or respond aspects of it. So, for example, my background is on biosecurity. I do weapons of mass destruction, which is biological, chemical, nuclear weapons. And on the biological side, the biosecurity side, my work has entailed trying to ensure that bad actors don't get their hands on biopathogens to intentionally do an infectious disease. And so what the US government did in 2013, based on the fact that we realized that the global community is not prepared to deal with an infectious disease outbreak, which we realized we really aren't, back in 2013, we realized we were not, and we wanted to figure out what do we do to try to build the capacity of countries to prevent, detect, and respond to infectious disease. So we started this effort called the Global Health Security Agenda, which was actually launched in February 2014, a month before Ebola hit the waves, and people started to realize why we needed something like this. And it's an effort that involves, right now, over 60 countries. I think 67 countries right now are involved in working on various ways in which we can strengthen capacity of countries to prevent, detect, and respond to infectious disease. And that also includes a couple of things that I'll highlight. One is interacting very closely with international organizations, including the World Health Organization, which has been a fundamental part of this effort. The Food and Agriculture Organization, which deals with the food that we eat and how that can lead to infectious disease, and also animals, because over 60% of the diseases that we get as humans come from animals. So we also have the World Health Organization involved as well. That's called One Health. That's called animal, human, food. That's an important part of the work. The other important part of the work is collaboration, working within the US government on the different departments and agencies that are part of this prevent, detect, and respond, everyone from State Department to Department of Defense to CDC to Health and Human Services to US Department of Agriculture, FBI, and others, and promoting this same kind of collaboration in the countries around the world. That is a very short rendition of it. There's a lot more connected to it, including work that we do around the world to assess how countries, to assess a country's capabilities in terms of being able to prevent, detect, and respond. And we can obviously say that after COVID-19, we're going to go back and have to do that again. So that's a very short synopsis of it.
So can you talk a little bit about why and how important developing these kinds of policies, these kinds of structures around the world are good for both global and national security?
It's very important because, as we have seen with COVID-19, every country is connected to another. So we realized in 2013 that we were having more of these infectious diseases that were going around the world. We had SARS, we had H1N1, we had H1N9, we had something called the Middle East Respiratory Syndrome. These diseases that start in a country, we realized could be very contagious and connected because of the way people travel. And so we realized that we need to work on a global effort. Every country is connected. So a vulnerable country in region A can obviously be connected to region B. And so we recognize that in 2013, that that's one of the fundamental reasons why all countries around the world need to strengthen their capacities.
Do you know of any specific examples of how countries that have participated in the GHSA, and in particular the JEE, the evaluation tool, how that may have helped a country deal with their COVID response?
Well, yeah, because the JEE in itself, what it does is it really allows a country to see, based on after 2 weeks of meeting with experts from the different international organizations, experts from different countries, after they sit down with them for 2 weeks and get an evaluation of where they are on different aspects of prevent, detect, and respond, everything from immunization to workforce development to biosecurity, biosafety. There's a list of things that we ask questions about, and then they get a grade of red, yellow, or green in each one of these areas. That in itself helps a country figure out what they need to fix, what they need to improve in order to be able to say they are ready to deal with an infectious disease threat. And then what happens is we provide assistance and others provide assistance. And if you go to the website, the GHSA website, ghsa.org, there are indications of where there's been successes. We've been able to do to strengthen biosafety and biosecurity capacities in many countries. We've done a lot of work in Asia, a lot of work in Africa, work in the Middle East, and also other countries as well. So there's things that we have done to actually do things on the ground. Particularly, very briefly, one case is I was in Liberia on the second time that they had Ebola, and I was able to see on the ground how they were able to detect exactly how it got there, who brought it into that country, and that's the activity that they were able to do that they could not do the first time that they had Ebola.
So let's talk a little bit about international organizations and their response, and more specifically, the WHO and the role they have played. And then we do have a question from the audience about whether or not you think that the role of the WHO has been diminished.
Well, the World Health Organization obviously is the only international organization we have that works on these type of issues of global health and infectious disease. Our CDC, Health and Human Services, works very closely with WHO. But people have to also understand that the WHO, like other international organizations, is also a bureaucracy. And there's things that they can and cannot do because of that. And that they're not a rapid response. They're not like CDC, where they send out people right now, or Department of Defense, where they can send out the troops. That's not really what they do. They're an international organization that sets standards, that sets rules, that sets like the international health regulations, which is something all countries should be living up to say that they can prevent, detect, and respond. So it's good to understand what they do and what they do not do, and they are the only organization set up to do what they do. Because they had some problems, obviously, with Ebola, there were some questions about, and I think there was a wake-up call for people to realize the limitations of the World Health Organization. And so, like I said, they're not a rapid response. They are an international organization that's set up to make rules, regulations, have discussions, have transparency on issues of global health.
Let's talk a little bit about sort of U.S. leadership and the role the U.S. can play. We know that there have been a lot of issues around U.S. response, lack of international coordination, whole scale around the world. But if you're looking at what's happening currently, we hosted, we spoke to Senator Murphy just a few weeks ago, who was talking about the need for, improving America's health security. Can you talk a little bit about this proposed legislation? Senator Murphy and Senator Romney are talking about building, America's health security. I think they called it America's Health Security Council or Health Security Challenge.
Right. I think one thing that this is going to do is to replace the council that was eliminated under the Trump administration, which was a group of people who were looking at and pretty much in charge of looking at issues of global health and infectious disease. So we don't have a place in the U.S., a group of people who are doing that because they were disbanded. And so I think the belief is that this would replace that. You'd have one person who would be the lead person to look at these issues of infectious disease. And this person would have a council of people who he or she would work with.
So a question from the audience about China and China's role in the ongoing health crisis. What role do you see China playing now into the future when we're looking at global health policy?
China should be, first of all, they're not part of the global health security agenda. So one of the things is they should be part of these kind of organizations that have discussions on a regular basis amongst the members about what their capacity is. There should be obviously much more transparency about what's going on in the country. I think that's one of the best ways that we can work with China or any other country, because China's not the only country. There's been other countries that's had diseases that, for whatever reason, do not want to report or are reluctant to reporting. So I think that we need to promote transparency. We need to promote more discussion with countries overall about what's going on in their country and what their capacity is and what's happening. And I think that's one of the best things that can come out of this.
So when you're comparing the United States role now and what it was like in 2013, do you want to talk a little bit about those contrasts?
Well, in 2013, we obviously had a very strong interagency process. We had leadership from the White House on this issue of dealing with infectious disease. There was close, regular meetings with the interagency. We met ad nauseum on issues of infectious disease. We were working very closely with other countries on it. Unfortunately, a lot of that has kind of dwindled. That push, that engagement, that U.S. leadership that you often need for these things to happen has definitely gone away. The leadership that we had at the White House is not there. The money that we put into it in 2014 is not there. We've lost the influx of CDC personnel around the world, which is very important to have our people out there also working with other countries in country, not waiting till things happen and then try to defend it here, which is not always going to be helpful. So we need to have that push. We need to have that interest. We need to have that White House leadership. We need to have that international engagement that we had back then. The resources and the emphasis is what we had back then that we don't have now. And hopefully this is a wake-up call.
Absolutely. So just want to remind everybody that if you have a question for Ambassador Jenkins, you can use the Q&A feature on the screen. And if you want to chat with your fellow audience members, you can use the chat function. So one thing that we're seeing now emerging in our country and many others are these disparities, right? That COVID-19 is disproportionately affecting communities of color, disadvantaged communities around the country. What can we do when we're developing tools like GHSA to address these disparities? Because they don't only exist here, right? They exist globally.
Yeah, I think that it's showing that it's not like as if we didn't realize that there are disparities. I think we just ignored them. I think we have traditionally ignored them. I think we saw that when we had the big fight to try to keep access to healthcare and the attempt to try to take healthcare from people who can't afford it. You see structural discrimination, structural issues within the U.S. that has impact on that. The people access to healthcare, of course, is a big one. Being able to have preventive healthcare is a big one, but it's part of what's in our structure of vulnerable communities. It's in our structure of the haves and have-nots, and this is, I think, what COVID-19 is doing is just shining light on disparities that we have had for many years. And it allows some communities who have had better access to healthcare to deal with this better than others.
So do you have any policy recommendations, or how can we, in the future, when we are, when we're living in a hopefully soon a post-COVID world and we're looking at rebuilding our global health infrastructure, how do we ensure that that's sort of built into the mix?
Well, these are things I'm working on writing about now, which is we have to take a much more holistic approach to these issues. We must look at them much larger, and we need to just be honest with ourselves about how we as a country distribute resources, how we let access to all communities. We are just not very good at that in many ways. And fixing this problem is me fixing how we look at ourselves and how we as a government and as a culture treat all Americans, so that when you have these kind of things come up, these disparities are not existing. It's a lot to ask for a government and a culture that has been a certain way for many years. But if you really want to fix it, then we got to be honest with ourselves about how we are as Americans. So.
What do you think, if any, what role will the private sector have in preventing and responding to global pandemics like this and into the future?
I think the private sector has a huge role, and I'm a little disappointed that they were brought in so late. The one thing that Global Health Security Agenda did was we have something called the Private Sector Roundtable, which was established after Ebola, because a lot of private sector entities were asked to do things and provide materials and things like needles for vaccination, and it was very haphazard. And some were asked to do things that they don't do and provide certain supplies that they don't have. And so they established something called the Private Sector Roundtable so that there could be a better understanding of what certain private sector entities, can provide. And so the goal has been to try to work with governments ahead of time so that when something happens, they know who to ask. And so we're really happy with this situation that, from what I gather, just not that I know everything, was that there was not really an outreach to private sector early on in terms of what was needed and who can provide what. And so there was kind of a haphazard reaching out to different, Jeff Bezos for this or this person for that. It should have been coordinated, like a lot of things have not been coordinated, unfortunately. There should have been a much more coordinated effort to reach out to private sector because they can provide masks and they provide gowns and they do all this stuff and try to see how they can provide things ahead of time. Unfortunately, we've been in a situation where we wait until things are needed, dire situations, and then we're reaching out to find out who can provide it. I'm hoping that after this, we will be better at understanding how to engage the private sector.
So a question from the audience, and sort of, adjacent to what you just said, do you see the need or the possibility of developing future international treaties to assure fundamental distribution of equipment?
I think international agreements would be helpful. I know that we're not in a situation where we're not in a political situation where agreements are something that the administration really likes to do. But I think international agreements to make sure that there's better coordination in a lot of ways would be helpful. I think that we've seen through this situation that we can't be haphazard, and sometimes the only way to fix it is to know what thing agreements do allow is predictability. And so agreements, if they can provide a little more predictability about who does what when, how it's going to be done, would be a lot more helpful. Yeah.
Thank you. So we have a question from the audience about how do you foresee COVID in Africa and its potential political fallout there?
Well, we know that well, it's interesting because we thought the U.S. was much more prepared than it is, and we're seeing what's happening here. And so hopefully, there are a lot of countries in Africa that do not have the capacity that the U.S. has, but it hasn't been as bad yet. So I think there's some lessons here. We'll see what happens in Africa, in some of the countries that don't have strong health capacities. But we're worse than anywhere else right now. So I think that's an interesting case study, not just for Africa, but for other parts of the world whose capacity for dealing with prevention, detection, and response has not been envisioned as strong as ours. And it's an interesting case study to see what happens. See what happens in Africa and other parts of the world that theoretically were not as strong as us.
And so following up on that question, there's a question from the audience about how you see some of the difference, comparatively speaking, between the U.S. and other countries' response to COVID-19.
Well, I don't really know all the others yet. I think that's something that we still need to look at, and how, because you can see how the U.S. domestically is doing it differently. So I think that's in itself a case study. Some countries obviously were not hit as strongly as others. I think that's something to understand and figure out. It may be more than how many Chinese travelers were in a particular country at a particular time when the disease was actually happening. You know, I think there's a lot to learn about that. The jury is out on a lot on this. And so the best way to answer that question without having an understanding of how everyone's dealing with it is just to look at how the US is dealing with it and saying how different states are dealing with it differently and having different roles. And that's probably a microcosm study of what's being done elsewhere as well.
So what someone from the audience wants to know if, you know, sort of this push to disband wet markets would help solve the spread of animal disease. Although if you read Josh Rogan's piece in the Washington Post, he offers an alternative to, you know, the potential of understanding where the virus came from. But I think the question is, you know, wet markets and probably the treatment of animals.
Well, you know, I have been a long proponent of, you know, the treatment of animals and the fact that most of our disease is coming from animals, and therefore theoretically, logically, we should be better at how we handle animals. It's logical, but once again, we see logic does not always dictate. So, you know, if people, but there's also an economic thing going on here. People make money from selling animals. People make money from illicit trafficking of animals. We don't know who's being illicit, which animals are diseased, who are being illicit trafficked. I mean, there is a huge economic part of this that will resist doing the right thing logically with how we deal and treat animals, in spite of the fact that over 60% of our diseases come from animals. So one would think that with that understanding, we would be better at how we sell animals around the world. You can go to different parts of the world and you will see how animals are sold on the streets, how they're trafficked on the streets. There's no thinking about whether there's any diseases or anything going rampant with these animals. So I'm hoping that there could be much more thinking about this issue. But like I said, there's a lot of economics. And when you have money involved, people start to change their minds about things. All of a sudden, oh, maybe it's not as bad as we thought. So we'll see. But I am a huge proponent of, one, how we treat animals, and the whole issue of illicit trafficking of animals. So I would love for that to get a lot more attention.
So I know we're running out of time, but I wanted to give you an opportunity to talk about your current work at Women of Color Advancing Peace and Security, and how you might be working to address the COVID, or how COVID comes into the work that you're doing.
Well, there's a couple of things. One, we have partnered with a group called Women in Global Health, and we have done something called Women 50/50, and we're highlighting women who work on issues of global health, particularly infectious disease. If you go to the website, you will see that. It's really trying to make it easy for women to be out there. And I will have to say, I'm happy to see, if you watch a lot of TV with like MSNBC and others, you're seeing a lot more women out there speaking. We also are highlighting the work we're doing. We're posting a lot of writings that's being done by women of color on these issues of infectious disease. So we're trying to get more voices out there. Like the organization itself is trying to diversify the space of foreign policy and security issues with more women overall and more women of color in particular. So if you go to the website, we have a special site for COVID-19 at our WCAPS.org website. We're trying to highlight some of the women and the issues. And we have a great one on Cuba. We had some of our members write an article on Cuba and what's going on there. We've had some on Africa. So we're trying to do some focused discussions on women around the world.
Ambassador Jenkins, thank you so much for the work that you do, and thank you for joining us today.
Always a pleasure.
Do you have anything to sort of tell our audience what you think, sort of a message for the upcoming weeks and months as we go through this?
To stay safe and healthy and indoors, of course, but also to know that there will be a vaccine, to hang in there with that. And that's to contribute to the discussions and to think about ways in which you can think innovatively about how we can be better at this in the future, because we always said infectious diseases are just what we're dealing with. It's always going to be out there. Hopefully not this level. This is way more than anyone thought. but we've always accepted those who work in this field that infectious disease is what we deal with. We've had many in the past that no one's ever heard of because they don't rise to the level that they get a see and an effect, but it's a fact of life. And so we just got to learn how to deal with it better.
Thank you so much. You stay safe and well, and everyone out there stay safe and well.
Thank you so much.
Thank you.